use Google Translate, yes, it helps someone kind of figure out what's going on, but sometimes the translations aren't the greatest. Um, so instead, what we decided to do, Katie, if you can flip to our other website.
Mm-hmm. Yeah. You see that okay?
Yeah. So if you click on the home page, yeah. So what we decided to do instead is actually go through an outside vendor and host the website outside the county structure. So this allowed us the flexibility to really kind of make it more user-friendly, be able to make changes as we needed, also create different sub-pages that were in language specific. So if we went to Spanish, or as we're going to go live now with the Vietnamese, it really allowed us to be kind of the owners of these pages to make sure that things are done in a way that we felt that is easier for the community to find. So for example, Katie, if you click on find a dentist or paying for dental care, so we work with our community contacts and providers to make sure that this information is active and that people can kind of click through and go where they need to go and get the information they need without having through our IT process. So, so the positive is, yes, we can make all these changes, we can do these things, we can make it more user friendly. One of the things that we quickly found out, though, is that as IT, we were relying on IT to do these changes for us. IT for Orange County is centralized, meaning that it services not just the healthcare agency, but also administration, the sheriff's department, all these other entities that sometimes asking them to change the color or to revise a link that no longer worked or that it was broken, or as we had events coming up for people and the event had already occurred, asking them to take it down or change the link, sometimes took a long time. And part of that problem was, is it now really helpful to the public if the links are broken or if it's a pamphlet from that for an event that ended 3 months ago? So then what we decided to do is use one of our staff members who was really experts in IT, but also they were the ones actually going on to the community and informing people and doing the outreach and things like that. They've actually now taken ownership of our website. So the good thing about that is that now, we want to change something, we want to add a blog, we want to make it more active. It's working within our structure that we can make those changes more quickly than it is to go through IT. But other things have come up, and one of the things that I always tell people is that working in these multiple structures, there's always things that will come up. So, for example, our website, because it's not hosted within the county structure, we use Google Analytics to figure out the click rates and things like that. Well, Gmail and Google is blocked off on our county computers, so we can't even access those reports through our regular county computers. So we have to utilize either laptops or tablets to be able to pull those reports off and then email them to ourselves. So there's things like that as you're trying to navigate the different structures of whose ownership of what, things that come up, and you have to kind of say, okay, how do we figure these things out? But for us, having the page outside of the county structure has really been helpful because it's more reflective of the community. We're not as beholden as to what community partners we put on here, or even waiting for IT to be able to upload a new blog for us. I think that's it for the items I was going to cover.
Yeah, no, it sounds great. Thank you, Sam. And then we do have a question. With building your website, did you work with your county communications team?
Yes. So in order to continue having the county kind of structure supporting us, so when we go through, when we write up our blogs or when we want to link to our county social media, we work with our communications department. So for example, the blog on the screen for Children's Dental Health Month, we work with the communications department so that they know we're releasing a new blog. They put it on their social media because their outreach on Facebook and Instagram and whichever other ones they use is a lot wider than ours is. So they'll post it on their social media. Hey, we have a new information on Children's Dental Health Month. Click here to find more. So then they link it to our blog through their social media. But they also kind of review the content that we have to make sure that it's still things that they are supportive of, and that if there's, hey, this is a very good campaign, we can use it in other programs. They do so as well.
Great. Thank you so much, Sam. I know early on we sent out your website for Orange County on our listserv. So it's great to hear from you of kind of what happens behind the scenes.
Yeah.
And just a reminder to the group, if you have questions, please use the chat box. We do want to make this interactive for everyone. Next, we have Carmen from Ventura County. Let me just switch over to the PowerPoint presentation. Carmen is the Assistant Program Coordinator for Ventura County and has been involved with their website. So Carmen.
Good morning.
Hi, Carmen.
Good morning, everyone. Okay, so for us, for Ventura County, we're actually very lucky that we had two wonderful interns. One of them had she was a hygienist, and she's the one that helped us with our resources and a lot of the, we also have the modules, the oral health module, so she's also the one that helped us create that, and a Google map. So all of these resources we have in our website. And then we had another intern that she had worked in the IT department here in the county. And so she had the background with IT and how to manage the website. So our website is actually under the healthcare agency. So we are under the county website, the healthcare agency. And we mirrored this on based on other websites as well. We looked at different things, different ideas, and we try to mirror that. And at first, we only had one page with all of the information, and we didn't have any, we had a couple of links, but now we have more pages. So, for example, if you go under the community resources,
Here?
on the left-hand side, there's if you click on that, it will give you a list of the local community resources. The free and local oral health resources like clinics, free clinics, and things like that. And we also have on top, right under community resources, we have a PDF of a resource guide that people can print. So if they can see the information that on the website, but they can also go ahead and print a list. So at first, at the beginning, when we had just the one running page, we had most of this information in there, but it was all into one paragraph. So now we were able to put it in different sections. And we also have here in our page, we have a medical provider map on the bottom. So it's basically a Google map where we were able to plug in all the medical dental providers, and we also plugged in the schools. So if, for a partner, if they want to take a look and see what dentists are available around, some of the schools, they can easily see that. So that's a school, and the ones that have the little tooth are the dental providers. So, you know, if you're looking for, you know, a specific dentist around, you know, your school, you can go ahead and see that with the Google Maps. And then, so at first, when we first had the one page with all the information, we also, down here, we had our resource matrix. And we had shared that with Katie a while ago. And basically, it's just a Google Excel sheet that had the list of the different resources that we were using here in the county. And it had a PDF link where you can go and print the resource. However, it wasn't user-friendly at all. So we went ahead and what we did under, if you go on the left-hand side, on the bottom where it says oral health resources, the one with the tooth. Oh. Okay, so right there, if you click there, so that's basically all of the resources we had in our matrix. But now you can actually see like a preview of the handout, and then you can click either on the English or Spanish, and then you can get a PDF of the resource that you can go ahead and print. And with this, our advisory committee suggested for us to have the matrix on the website. And then, you know, we decided to do this so that for sustainability purposes, you know, people, we can give them, you know, we go do a presentation, we give them a copy of the resource, and we tell partners that they can go on our website so that they can print the resources that they need. And so our intern, the one that worked with IT, she left me a step-by-step guide on how to make changes to the website. So, you know, how to add events. You know, we have a calendar over here, so we can add, you know, events that are going on. And then I can go ahead and make changes that we need. And I see there's a question about the provider map. We try to update the medical dental provider every month or every 2 months because, you know, the medical dental providers do change on the Smile, California when you go look for a dentist. So we try to keep that updated. And I think that's pretty much it. I mean, we, like I said, we had already located a bunch of the resources with the hygienist. You know, she's the one that helped us. Oh, over here we have on our left the oral health curriculum. That's our oral health module. And if you can click in there, you can also go ahead and print those. And the modules also have links to the resources that we use. So if anybody wants to use the modules, they can go ahead and also click on the link, and they can go ahead and print the handouts that go with the module that they're presenting.
Okay. And Carmen, did a lot of this work go through a work group as part of your advisory committee, like with the website? Were you able to kind of bring in the work group to kind of help guide the website on here?
Not a lot. I mean, they gave us suggestions in terms of what they wanted to see on the website. Like they wanted the Google Maps on the website. They also wanted the resources on the website, but there wasn't like a lot of specifics on how. It was ideas from like our manager, and also looking at other websites and see how you know they look. I think there's the concept that we have for the resources. I think I saw it. I think it was the AAP, the American Academy of Pediatrics. I think I saw something like that where they had a picture of the handout, and then they had the English and Spanish, and you can click on it to print it. Also, I think Mouth Healthy also has that kind of setup.
Yeah.
I remember it's Mouth Healthy or another one where you have a picture, a preview of the handout, and then you click on the English or Spanish, and then you can print it. One of the challenges that we have as well is, and you know, I'm a big advocate for having resources available in other languages. Our website, we have the Google Translate feature, which I also don't like it because it's not, the translation are not the best. But that's what we have for now.
Okay. Well, thank you so much, Carmen. I know you guys have really worked to bring all these resources together. And I believe you were a detective in your last life, because the way you put together all the resources early on, it's very, very impressive. So it's great it can be shared out with other counties.
Yeah, there were some resources I couldn't, we looked and we couldn't find in Spanish, and then later I was able to find them, and there's a couple that we're still working on to have in Spanish.
Well, great. Thank you very much. And now we're going to go to Northern California. We're going to go to Marin County, and Danica is going to share about their process and what they're doing up there. So I'm going to go ahead and go back to the PowerPoint. Okay. Let's go back here. So we have the Oral Health Program Coordinator, Danica Ning. So Danica, can you please share about Marin County?
Can you guys hear me okay?
Yeah, we can hear you great. There you are.
Okay, there you am. So I actually jumped on board with our oral health program a few months after our website was developed, but I can talk about the processes behind that. So similar to what I'm hearing with other counties, especially with the Orange County, Marin County kind of has its own specific kind of web page for their different programs that are kind of specific in what type of messaging they want to have or information. So the oral health program in our county is housed through Health and Human Services, but specifically under the Community Health and Prevention Unit. And a majority of all the different programs under this umbrella, including nutrition wellness programs and the tobacco control program, all have their own individual website. So that specific county webpage is we actually linked our website that you're seeing on the screen now to that page. So if anyone goes on Health and Human Services for Marin, we'll directly see a link to our website, and it will directly bring to this page.
Okay. So Danica, yours is a similar setup as Orange County, where you have two websites,
yes.
One on the public health and then one that's private.
Yes, and the public health website doesn't have too much information. It talks a little bit about the oral health program and what it is and contact information, but we really wanted to make sure that any information that they would need in terms of what the strategic plan is, or the needs assessment of the county, any information about insurance and how to sign up for insurance, or any infographics or public facing documents. All that information is linked directly, and it's made explicitly clear on the public health website to go to this website. Just because this houses the greatest wealth of information, so we wanted to make sure that that distinction was clear. So that's why we kept the public health website fairly simple, and our private website more populated. But it is public facing, and there's a lot of information. So, and the reason why we did this was when we started getting our oral health program started, we met with our steering committee and our communications work group, which is one of 3 work groups in our county, to see what they wanted in terms of messaging to the community, as well as we really wanted to make sure our community members and our community partners really involved in our communication processes. So in terms of what information they would like to see. So as you can see here, some of the big things that they wanted to see is a lot of what is going on. So we made sure we included our community health improvement plan, our CHIP, our strategic plan, and our needs assessment, so that we could really inform any curious community members about what is the state of oral health in our county and what we are doing or what we're planning on doing to improve that. Then underneath that, under the Learn More About Oral Health in Marin County, we actually have been working with our epidemiology team with something called Live Stories. And essentially it is an online data bank of front-facing data, so information about most recent kindergarten oral health assessment, information about pregnancy dental utilization in pregnancies, barriers to care. So we wanted to provide all this information to the county so that community members and people around the county are most informed about what is going on essentially in oral health in the county, so that they can see what we're doing and like where the basis of the action steps we're taking are. If you wouldn't mind going back to the website. And then on the on the right-hand column, all of these messages were vetted and approved by our communications work group. So our communications work group meets monthly, and about half the meeting is spent on updating, improving, and creating messages for the community, and including what we're going to put out to the put out onto our website. So in our communications work group, we have members from First Five. We have dentists, specialists talking about fluoride, things like that. So we have messages such as like Potter the Otter in both English and Spanish, and basic information that if anyone was to go onto our website and wanted something to pass out to their class or their community, or if they just wanted something quick to look at about what should I do during pregnancy for oral health. We have information there, infographics that are easy to use. They've been vetted by our work group, also like the American Dental Association or the American Association for Pediatrics, for example. We also have little sections about any oral health in the community and community news. So this section right here was actually new as of, I believe, December, and this was a message created by our Director of Public Health with support from our Superintendent of Schools in Marin County to support oral health. So it includes also information about more locally what is going on in our community in terms of oral health. So those are kind of some downloadable public front-facing documents that are essentially infographics or information that are quick and easy to look up and download. And if you scroll down, we wanted to include essentially a section to how to find oral health and dental services in our county. So we created 3 columns. So persons without dental health insurance, we'll want to include as much information as possible about different federally qualified health centers in Marin County, information they can use to call, to look up, and to take a look at what other services we have. The middle column is essentially all Medi-Cal information. So Medi-Cal has dental covered. Information in English and Spanish, and we're working on accessibility and getting more translated documents on here as well, and then information on how to enroll. And then on the other side, we also have information for private dental insurers and covered California insurance too, so you can look up information right there too about how to find private dental providers. Then if you scroll down, you'll see we just have more resources and additional resources, including fluoride and sealant resources information, more about Healthy Marin, health indicator reports, and information from CDPH Oral Health Program. And we check these about monthly to make sure they're up to date, and we vet them through our communications work group to make sure that these are still the messages that as a community we want to see and want to put out as well. And then if you keep going to the bottom, we have a lot of our community partners listed down there, and it's all linked up to where you can go to their websites as well, and a contact us sheet. So this website is WordPress. It is very simple to use. It is one page. Full disclosure, I am not a webmaster, web developer, so this for me has been very easy to use. But on the consumer end too, we have been hearing from our work groups who have kind of plugged it to their sources to take a look at as well, that it is easy to look at and user-friendly to get information. So a few things coming up that we're working on too is we're working heavily on the social media and through our communications work group as well. So we're going to develop a community toolbox that's kind of under the section for learn more about oral health, where we're going to include a lot of the social media messages that we have created that are going on both our HHS Instagrams and our own personal Facebook. We're also going to link our Facebook to our website too, and this is more on that social media end as well, to really get all the messages that we want to about oral health and how to maintain oral health out to the public. So we're really, I guess the theme you can say is we're really relying heavily on our communications work group, because we really want to make this, we're really taking a community-based approach to distributing oral health information and education. We really want to hear from the community members about things they would like to see, and we're using a lot of that input and involving them in the development process to really make sure that the community is seeing the sorts of things they want to see.
And then
I think,
yeah.
Oh, go ahead.
And then Danica, when we had talked earlier, you had a really great point of, sometimes you want to share on your website topics that maybe, maybe kind of a hot topic. And being in Marin County, one of our team members, Marjorie Stocks, is able to attend your communications committee. Can you just share a little bit of kind of how you approach fluoride in Marin County? Because it can be a hot topic.
Yes. So fluoride in Marin County is, like Katie said, is a very hot topic. The majority of Marin County is fluoridated, but you have areas such as West Marin, which is on well water, and far north Marin, which is on the same watershed as Sonoma, that aren't fluoridated. But between Marin and Sonoma, we have a very high anti-fluoridation population. But at the same time, so putting very front-facing documents that say fluoride over everything, we wanted to have a discussion about that because we wanted to have more of a constructive communication environment rather than destructive, I guess you can say. So we really involved our community members in this process, and one person in particular, Marjorie Stocks, the UCSF, has really been instrumental in kind of advising us about how we can get that fluoride messaging out there without in more of a subtle sense, I guess you can say. So if you look under Learn More About Oral Health, you can see that we have a lot of documents such as Protect Tiny Teeth, Rethink Your Drink information, but we also have information about fluoride. So it's hidden in there, but it is public. And then also at the very bottom where there's additional resources, we have a wealth of actually resources and links for fluoride that have fluoride information about what exactly is fluoride, what does it do for your teeth, why it's encouraged. In this approach, we're not necessarily not having that information there, but we're taking a more subtle approach to it because we believe that we need to have this information there. And when we create our community toolkit, we are going to include social media messages about fluoride specifically as well and how fluoride protects your teeth. But again, we're doing it in a way that is there, but not, I guess overtly there, I guess you can say. So that's kind of an example of how we take community input in regards to what types of messages we put out and how we should put it out there, because they are members of the community, and Marjorie is a member of our community as well. So she knows the community members, what they would like to see, and she also knows what the overall feeling is about it. Even so, we know that all of this information is important, but we want to make sure that we put it out there in a way that's not going to require us to take it back down again.
Yeah, and you guys have been very thoughtful and on your approach to how you look at these, the process in place and really getting the messaging out there and then going through your work group. So thank you very much, Danica, for sharing. And I know Danica and I both had the privilege to attend the Contra Costa advisory committee this last month, and this is kind of where some other ideas came from. So I'd like to go ahead and introduce Frances Gutierrez. She is from Contra Costa County, and she's going to be sharing about their new website that they just launched.
Okay, thank you, Katie. Can everybody hear me okay?
Yeah, we can hear you great.
Okay, hi, everybody. Good morning. My name is Alexis Gutierrez. So I am the health education specialist for the Community Oral Health Program website and for our program. So I'm going to tell you guys a little bit about our program in itself and our website, but I was not here in the launch, so I'll do my best to give you some of the history. So our Community Oral Health Program website was launched at the end of summer of 2018. So originally, before our LOHP program began, we had our Children's Oral Health Program. Katie, if you want to scroll down, we'll show you a little bit of that on our website, in which their program began in 1977. So they've been around for a long time. So since then, we merged together with them to create an umbrella of the Community Oral Health Program. So now we work together, and it's displayed in separate tabs for our LOHP. So yes, the second one is the LOHP tab, and you can see Katie there. So this was our recent oral collaborative for Contra Costa meeting that happened in January. So that was really exciting. We added those photos there. So starting off our website, we had a template already placed by Contra Costa Health Services. This made it much easier for designing the whole layout together. So we are part of the FMCH, the Family, Maternal, and Child Health Programs. So on the tab of your left, if you want to scroll up, you'll see that all there. So we have adolescent health, Black infant health, and a couple ones listed. But this month, we launched our new website, and our decision process for this was basically a staff meeting that was once a month for our dentist manager and myself, the health education specialist, to meet and start brainstorming of who we wanted our audience to be. So previously, before our LOHP program began and really launched with our collaborative, our audience was getting stakeholders involved. So it was mostly based towards our children's oral health. And so we didn't have a lot of resources for that yet. We were mostly just trying to have people come to our page to see if they wanted to be involved. But since we have our collaborative now, what we wanted to do is add on to that as our audience and include the community as well. So a big thing that we added was the resources for community partners toolbox on the right side. So this big yes right there. So this is a big launch of ours this year in January. And with this launch, we wanted to emphasize community-friendly links, which were easy to follow and access. And our process of updating content starts with having one person, which is myself, lead with the CEI team. So we work with our internal CEI, which is the Community Information Technology team, and they develop all our web content. And I believe for all of Contra Costa Health Services, all our websites must go through our internal staff. And they're a great team. They work really actively with us via email, and we also see them in person. So for Contra Costa County, we're pretty big, but a lot of our buildings are in Martinez, California. So we just take a couple, minute drive to their department and go ahead and sit in person with them. So that was our process. We really drafted a lot of it with brainstorming with the dentist that we have and our manager and myself, and then we met in person with Aldrin, our CEI person, and our web content. So a lot of emails and a lot of in-person brainstorming is how we got to this. And it relieved most of our challenges having one person lead. So myself, once we established one person as a gateway of communicating drafts and edits with our CEI team. So that was our big advice to other LOHP programs, is to place one person so they can keep it updated. So some of the challenges that we have seen is to make sure that the links that we have on there are not broken and kind of maintain that. So for example, if you can scroll down, Katie, we have our dental resources tab as the third one. And this came about with our collaborative meeting stakeholders and our members. They really wanted to see local links, California links, and also where to find dental clinics in Contra Costa. So we have everything updated through a PDF flyer. So if you can click dental clinics in Contra Costa, I think it's the first one up there. Yes. So we have this all linked here, and you can see our county clinics, our school-based dental clinics, community clinics, and then other partner clinics that we have. So this is something we got feedback through talking with the community. And as a community health educator, they used my resources of being able to go out into the field and do a little bit of outreach and really talk with our community members what they wanted to see. So we used a little bit of our community, and we used a little bit of our community stakeholders through our oral collaborative to kind of vision what we wanted. But our overall goal was really to emphasize community-friendly links, and that's why we added the toolbox straight up in the beginning of the page. And here we have the oral health presentation. This is a scripted PowerPoint that people can download. It's completely scripted, and it gives you a 101 of basics oral health. This is one toolbox that we requested because we had a lot of members that were from First Five or WIC or just different clinics that really wanted to learn about the basics, but they didn't have the time or the staff efforts to host somebody coming out there for one of us to speak. So this is a big thing that we started to do, and we have 3 more presentations coming up, including dental with prenatal. We have a parent and a school staff that talks about COHA. So this was our launch. When we talk about community friendly, we really wanted it to be accessible to everybody to download. And we also, this is where we incorporate our Smile California. And we also, yes, this is a great one. We have our dental, medical, and I believe social services. I think I got to scroll up and see it. I'm sorry, I'm a little rusty here. It is our community partners with medical, dental, and behavioral services. So this is a map that was launched by our community partners and our team. and it basically breaks down who is doing what in our community. So we partner with other clinics like La Clinica, and they go to different elementary schools and high schools, and we go to a couple too with our community oral health program. So this is a map that we heard feedback that everybody wanted to see who does what and where. But this was our process. We haven't had too many challenges because our CEI team works so closely with us. In order to launch this, we had to go through 3 mock drafts, so it took about 3 or 4 months to get to this point. But we haven't had too many challenges, luckily and thankfully, because they work so closely with us. The layout was already there for us to use. We don't have access to our own public space, but we're looking into that, and hopefully we can get that. But for now, I believe that all of Costa Health Services, all programs have to go through our CEI team. And typically, if we have an edit, it takes about 2 to 4 days to get something done. But like I said, the biggest relief of our communication challenge was just having one person lead, which is myself. And I don't have too much experience with web design, but I did have some experience with social media and kind of what it looks like to make sure the audience, the community can see. So what we did is add a lot of photos of our team that is seen in the community. A lot of our community trusts our dental team. So you could see right here, this is one of our RDAs, and this is a student from a adult education school that's working with the RDAs. And so we just wanted to highlight the work they did. And this is our whole staff right there. And so that was a big piece. We wanted the faces that work in the field every day to be known and acknowledged. So that's where we're at for Contra Costa.
Great.
I think that's it.
So much, Alexis.
Thank you.
Yeah, and then I know we're up on time, so I'm gonna go through, I kind of lost my spot here. The remainder of the PowerPoint presentation, most of this is gonna be links to resources that this will be available. You guys can click on it. These are just really takeaways, but really just keeping in mind what these 4 counties are doing, kind of that process behind it, working with your advisory committee, your work groups, your IT department, and messaging out what you're doing to the community. So these are 4 categories that are kind of high level, what we talked about, that can promote those materials to your community. And then also keeping into like what goes on your website. Analytics are really helpful, kind of knowing where the community is searching and what you can build. Also, there was a lot of discussion about how do you organize the content, who is your audience, who are your stakeholders, are they schools, superintendents, are they parents, are they providers? So kind of looking at your layout and keeping this in mind. And as you build those social media platforms and libraries, there's some material that's very well done that is out there and available. It's gone through focus groups, it's been vetted. Smile California is great. They have a whole gallery. Tiny Teeth, they have different languages, and this is very well done. It's easy to use, it's free, you can customize it. So look to see what's out there already, and then you can add to your website. Campaign for Dental Health, great information on bringing in fluoride. And then also the ASTDD, they recently had a webinar in November on social media campaigns for public health departments. So highly recommend this. And also when we talked about accessibility and language, the Maternal and Child Oral Health Resource Center has a 2-pager on kind of that language to use and what to keep in mind in best practices. So you may be starting with a blank website, about a third of you, this is where you are, but we want to be able to share with each other. So this is a big thank you to Marin County for sharing some templates that they have. These are customizable, these are going to be available. Our goal is to get more of like what you're creating on the COTAC website and our new resource center that we're remapping, so then we can share with each other. So big thank you. And then also if you're looking for high resolution images that you can use, there's some great links here that you can go to. You can type in dental keywords. Again, these are free or they're low cost. It's a lot of great things out there. And then so you guys can learn from each other. I know we highlighted 4 counties today, but there are more of you that are doing websites. So please go on each other's websites, see what's being done, how they're being messaged. You guys have great campaigns that are out there. You guys are getting started, and there's a lot lot there. So again, thank you to our presenters today. Thank you for all of you of what you're doing with the counties and messaging oral health into the community. There are a list of resources here from all the slides, so you can go back to. And thank you. I really appreciate your time. I know we're over just a few minutes, but if you guys have any questions and anything in the chat box. Okay. Oh, love the graphics and the pictures. All right. Thank you, everyone, today. It was a pleasure to work with you and to share the information and to hear from our presenters. This is going to be available, and the PowerPoint presentation will be up by the end of today on the COTAC website on the home page. If you have questions, please reach out. I did record about half of it, starting where the counties were sharing. So thank you, everyone. Have a great start to your week and reach out with any questions anytime. All right, we see some annotation here. All right, bye, everyone.